everybody, welcome to Just Upright. My name is Doc Jing Ruder. I'm a doctor of physical therapy and I'm a certified dementia practitioner. So if you are new to my channel, thank you for watching. Please take note, I have a playlist of more than 40 videos on how to apply as physical therapist here in the US, so check that one out. I also have a playlist about health in general, how to decrease your risk for stroke, how to decrease your fall risk, and the like. Also, there is a playlist on how to become an on-call PRN physical therapist and physical therapy documentation videos. Okay, so check that one out and then check this one out as well. So if you haven't checked it out yet, I have 3 books published and they are available at Amazon.com. You just type Gina Lynn Ruder and these books will pop out. Okay, so the first one is PT Path to US, a foreign trained physical therapist step-by-step guide to US application. So if you want to have a copy of that. And then practical tips for therapists prior to migrating or starting your US practice, full of words of wisdom before you start your US practice here, and practical tips to improve your posture, balance, and decrease fall risk, the Just Upright book. Okay, so today I'm going to answer the question after I finish my transitional Doctor of Physical Therapy program, or TDPT, or after I graduate as Doctor of Physical Therapy, can I call myself doctor? And we will look into American Physical Therapy Association website for a direct answer to this question. Okay, so we are here at the website of APTA. So it's apta.org, and that is their official website. So we are under the frequently asked questions, and this is question number 34. And this is, once I earn a post-professional DPT degree, can I be called doctor? The answer is yes. Conferral of the DPT degree means that the graduate is entitled to all of the rights and privileges associated with the doctoral degree. APTA has a position use of the title doctor by physical therapists that states, the American Physical Therapy Association supports the use of the title Doctor of Physical Therapy only for those physical therapists who have graduated from a DPT program. In order to provide accurate information to consumers, physical therapists who have earned Doctor of Physical Therapy degree and those who have earned other doctoral degrees and use the title Doctor in practice settings shall indicate they are physical therapists. Use of the title shall be in accordance with jurisdictional law. The choice of whether, where, or when a practitioner exercises rights and privileges to be referred to as doctor is a matter of professional judgment and jurisdictional law. In addition, employers may have individual facility policies on this matter. Okay, so it is clear that according to APTA, it is okay for us to use the the name doctor before our real name, but at the end of it, you have to indicate PT. You're a physical therapist. Just to be clear, and it all depends on where you work. Just like what it says. Individual facilities may have rules about this, that you cannot call yourself doctor because that can create confusion. But what I'm seeing right now is that those people who are in private practitioner setting, so they are a solo practitioner, they have their own clinic, or they go, they see client on one-on-one basis. They are entrepreneur. Just like me, I have my own channel. Okay, so we have a small business. Okay, if you have a small business, you can set the culture, you can set the rule in your company, and it doesn't mean that you can break the law. We're not breaking the law by calling ourselves doctor. It is recognized because we finished the Doctor of Physical Therapy degree. We went to school for additional years just to gain more knowledge and be more competent and confident as clinician. Okay, if you have your own company, if you are a solo practitioner, private practitioner, okay, that's what I see, that the doctor, most of the practitioners call themselves doctor. I have my own YouTube channel. I go by Doc Jing. I follow the APTA rule, that I can call myself a doctor, but I have to indicate I'm a physical therapist. Now, if you are working for a company, they have their own rule, and they have their own policies. So you have to go by their rule, by their policies, because that is not your own company. They have their own rules and policies. For me, it all boils down to whether your degree is being celebrated or not. Okay? Of course, if you have your own company, you celebrate that you earn a doctorate degree. And based on APTA, you have the right to call yourself a doctor of physical therapy. Okay? And of course, if you have your own clinic, you want your consumers, your clients to know that you, as the owner or your other therapist, have a degree, that they went extra mile to earn more degree, to be more competent and confident, gain more knowledge, up-to-date information. And that is also part of the business structure. Okay? So it's a place where you can celebrate you as a doctor of physical therapy. Unfortunately, there are politics involved in different companies. Some doctors don't want you to medical doctors don't want you to call yourself as a doctor because you are just a physical therapist. So that instead of being celebrated that you're a doctor of physical therapy, you are looked down upon or scorned upon because you're just a physical therapist and you're not a real doctor. Okay, that is a very sad situation. I feel like people who are secure in their own skin, in their own achievements, in their own position, can celebrate someone who went extra mile to earn more degree, and that is a place that you want to work. Okay, but just like what APTA website stated, it is all depends on the jurisdiction, your state, your company that you work for. Okay, and whether or not you can call yourself a doctor of physical therapy. To be honest, in my own company, when I go see my patients in their home, I have a badge that says Dr. Ginalyn Ruder, physical therapist, doctor of physical therapy, and certified dementia practitioner. I introduce myself as a physical therapist. I am Jing, physical therapist from this company. And then when I develop the rapport with the patient, I educate my patient. I try to understand what they need, how can I help them. And then sometimes they will look at my badge and they will be surprised, oh, you're a doctor? Yeah, I'm a doctor of physical therapy. For me, in my own experience, the degree is just secondary. The primary concern of your clients or your patients is, do you care? I remember the saying, they don't care about your degree until they know you care, something to that effect. Okay, so the primary thing is, you as a therapist, do you know what you're talking about? Do you understand personally, professionally, why are you asking this client to do these exercises? What is your goal for doing these exercises, or for asking your clients or patients to do these exercises or tasks or activities? What is the goal? Is it beneficial for them, or you're just going through the daily routine? Okay, so if the patient feel that you're really concerned with their well-being, that you are there to help them out and figure things out to make their life easier, manageable, and better, so that's the primary concern. That's the primary thing. The degree is just the bonus. Okay, I'm not saying that you should not go to school to be a PDPT, or a doctor of physical therapy. For me, going back to school after 19 years of being away from school has taught me a lot. It has enabled me to gain more knowledge, updated information, be more competent as a clinician, and more confident as a physical therapist in managing the condition of my patients. Okay? So I know it's a little bit, up in the gray area right now, but for APTA, it is clear that you can call yourself a doctor as long as you indicate that you're a physical therapist, and do not mislead your clients, your patients, that you are a medical doctor, that you are a doctor of physical therapy. We are a doctor of movement, of exercise, of improving the life, the function of our patients, of the people that we serve. So I hope that is clear. Please share this video to your friends, to your families, to your sphere of influence. Our goal is to reach as many people as we can, to help as much as we can. Thank you so much for watching, and stay blessed.
Thank you so much for watching. Please do not forget to hit the subscribe button below to be updated with the latest video releases. Share this channel to other people you know who will benefit from Just Upright videos. Thank you again, and stay blessed.